Hi, Dr. Scott here, and today I want to address some common complaints that I hear in my office on a regular basis. I get complaints every day from my patients about the standard health care that they're getting from our conventional health care system. The thing that many of my patients don't realize is our current healthcare system is not really health care at all. It's crisis care or sick care, and it's run by insurance companies. All, or at least 95% of all medical procedures and testing go through the insurance. That means that if the insurance company denies or approves what the doctor does, or it doesn't get done at all. So I hear my patients complaining things like insurance should pay for functional medicine testing, or insurance should pay for my supplements, or insurance should pay for wellness care. My patients are mistakenly thinking that the insurance company's job is to keep them healthy. The truth is, insurance is about risk management. So to help you understand this from a little better perspective, I did a little research into the insurance foundation and where it all came from. And way back in the 1940s, there was a group of farmers who got together and they decided that, if one of them got hurt, they might not be able to provide for their families and it could be a bad situation. But if they all put some money into a pot, then there'd be enough money left over, and statistically speaking, they all wouldn't get hurt at the same time, and that should help take care of it. And not only did this idea work, it worked so well that there was actually money left over. This became a great business. And this is the foundation of all insurance, whether you're talking about health insurance, auto insurance, home insurance, whatever it is. The idea is that everybody pays in, but not everybody gets paid out. That's the only way it can work. And that's how the insurance companies can build huge buildings and have huge CEOs with $500 million bonuses, because everybody pays in, but not everybody gets paid out. And that's our current system right now. So what you have to realize is that what you're paying for in your premiums is protection in case of an accident, in case that you have something happen. But it's not about keeping you healthy. And it's not something that everybody should get. Everybody deserves to be healthy. Your insurance is going to manage your risk for the possibility that something unforeseeable happens to you. So another good way to understand how this works is looking at auto insurance. So all insurances work on the same premise. Let me ask you this question. Does your auto insurance cover brakes? Are brakes important? Would you ever think about not putting brakes on your car? That'd be silly, wouldn't it? How about tires? Does your auto insurance cover tires? Of course not. But would you ever think about not putting tires on your car? Okay? So, but if you don't put brakes and you put tires on your car, what's going to happen? You're going to run in the back of somebody, aren't you? And then guess what? It's going to be covered. So this is how insurance works. And health insurance is no different. So right now, we all pay a lot of money for our premiums, and we expect all our health-related needs to be covered by our insurance company. But our insurance company isn't going to cover things like brakes and tires for our body. So if you don't take care of your body, and you don't put brakes on your body, you don't put tires on your body, what's going to happen? Well, you're going to run into the back of diabetes. And then guess what? It'll be covered. You're going to run in the back of heart disease. And then guess what? It's going to be covered. You're going to run in the back of cancer. Guess what? It's going to be covered. So this is something that, sometimes you have to break things down into real simple terms to really understand what's going on. But since we all do it, and all your friends and all your neighbors are doing the same thing, and all the media is talking about health care and health coverage, you don't realize what you're really doing to yourself. So again, our current system is really about crisis care and risk management. It's not about health. Now, they call it health care and health insurance because that sounds nice, and that's what marketing experts have told these big companies how to phrase their terminologies, things like that, but it doesn't really accurately describe the services that they're providing. So let me ask you another question. Who does your doctor work for? Again, this is something that, again, you can ask a very simple question to make people think. But the easiest way to answer that question is, who pays your doctor? Yeah, you may pay them a small copay or something, but the reality is that your doctor gets paid by the insurance company. So again, let me ask you a question. If one procedure, or let's say a diagnostic test is covered and one diagnostic test is not covered, which one are you going to get? One that's covered, aren't you? Now, again, why is that particular diagnostic test covered? What particular facility is going to provide that lab service, and how they get that contract? Were they the lowest bidder? Again, we could talk for hours about these things, but these are the simple things that we don't realize that's going on in our healthcare. How about procedures? If there's one procedure that's covered and one procedure that's not covered, which one are you getting? Well, it's covered, aren't you? Because the doctor's not going to pay for it out of his pocket, right? That's how he wants to get paid, so he's going to recommend things that are covered. How about if one procedure pays better than the other? Again, these are things we don't think about, but what it really comes down to is that our health care is being dictated by what's covered and what's not covered. And again, I'm not trying to say anything bad about doctors. I've worked in the insurance industry my whole life, and these are the realities. So, you're a doctor and you're trying to do what's right for your patients, but you're also trying to run a business and continue to stay in business so you continue to try to help people within the system. But again, you got to realize, within the system. As long as you stay within the system, then you can do what you need to do. But if you try to go outside the system, it's not going to work. So again, these are very important points that many of my patients don't realize, and that's why they mistakenly assume that your insurance company is there to keep you healthy, but they're not. So the bottom line is this. Our current medical system is great at risk management, diagnosing and treating disease, and these are services that we need. Our traditionally trained doctors are good at this. If you're in a massive auto accident, we're in the great place to be. We have great emergency care. If you have a massive heart attack, we have great emergency care. You pay for your insurance to manage that risk, to the possibility that you might get sick or that you might have something traumatic happen to you. But if you want to prevent being sick, if you want to stay healthy, then you're going to have to do it on your own, or hire doctors like myself to help you with those goals. So remember, if you don't put brakes on your tires on your car, then you're going to end up hitting somebody. And if you don't do some preventative care and look at function from a functional medicine perspective, then you're just waiting to run in the back of some disease and wait for it to be covered. So this is why waiting for things to be covered is not always a great way to deal with your health. So this means do not expect the insurance or your traditional trained doctors to give you the help that you need to do something that they're not even trained to do in a system that will not pay for it. So I think most of the complaints that people have about insurance and our current medical system are due to the fact that what is health care and not sick care. And they don't understand that we have a sick care system. So as I mentioned, our current system, it's not necessarily their fault because, again, the media and the insurance companies have labeled their care health care and health care insurance and all these types of names to make you feel good about health. But again, if they called it sick care, that wouldn't sound very good. Or risk management. So again, it's very confusing. And the fact that our current system dominates all health-related information in the media. So I know I will continue to get complaints from my patients about healthcare and health insurance companies. But hopefully this video helps you understand a little bit more about our current system, and if you want to get healthy, that you need to think outside of that system and utilize that system as what it is. It's a risk management system. It's not about health. So have a great day, and I'll talk to you soon.